In this video, we will discover every pertinent medical fact concerning liver cancer. The architecture of the liver must first be discussed in order to comprehend liver cancer. The liver is a reddish-brown organ that is situated above the right kidney, right stomach, and intestines in the upper section of the abdominal cavity. Blood enters the liver from two different sources: the hepatic portal vein, which carries nutrient-rich blood, and the hepatic artery, which brings oxygenated blood. The liver consists of two main lobes. Both are made of segments that consist of lobules. These lobules are connected to small ducts or tubes that connect with larger ducts to form the common hepatic duct. The bile produced by the liver cells is transported by the common hepatic duct to the duodenum and gallbladder. The liver has been linked to crucial processes: the production of bile, the production of specific plasma proteins, the production of cholesterol and special proteins, the conversion of extra glucose into glycogen for storage, the regulation of blood amino acid levels, the processing of hemoglobin for the use of its iron content, the removal of drugs and other poisons from the blood, the regulation of blood clotting, and the clearance of bilirubin are some of the more well-known processes. What is liver cancer? Cancer that starts in your liver cells is called liver cancer. Hepatocellular carcinoma is the most prevalent kind of cancer that can develop in the liver. More frequently than cancer that starts in the liver cells, cancer that spreads to the liver from other organs. Instead of being referred to as liver cancer, metastatic cancer refers to cancer that starts in another part of the body, such as the colon, lungs, or breast, and then spreads to the liver. Metastatic colon cancer, for example, refers to cancer that starts in the colon and spreads to the liver. This type of cancer is named after the organ in which it first appeared. What forms of primary liver cancer are there? Hepatocellular carcinoma, cholangiocarcinoma, and angiosarcoma are the three most prevalent kinds of primary liver cancer. The most frequent form of primary liver cancer, hepatocellular carcinoma or hepatoma, begins in the hepatocytes, the major cell type in the liver. The cells lining the bile ducts, which link the liver to the gut and gallbladder, are where cholangiocarcinoma, also known as bile duct cancer, begins. Angiosarcoma is a rare kind of liver cancer that develops in the blood vessels. What are the symptoms of liver cancer? Early primary liver cancer symptoms are typically absent in most patients. Unexpected weight loss, anorexia, upper abdominal pain, nausea, vomiting, exhaustion, jaundice, and abdominal swelling may be among the signs and symptoms when they do manifest. What are the root causes and risk factors for primary liver cancer? When the DNA in liver cells undergoes modifications known as mutations, liver cancer results. Every chemical reaction in your body has a set of instructions contained in each cell's DNA. These instructions vary as a result of DNA mutations. One outcome is that malignant cells may start to proliferate out of control and finally form a tumor. It is sometimes possible to pinpoint the source of liver cancer, such as chronic hepatitis infections. However, it is not always known what causes liver cancer to occur in persons who do not have any underlying disorders. Chronic infection with the hepatitis B or C virus, cirrhosis, some inherited liver conditions, non-alcoholic fatty liver disease, excessive alcohol consumption, and exposure to aflatoxins, poisons made by molds that grow on crops that are improperly stored are some factors that raise the risk of primary liver cancer. How to diagnose liver cancer? Blood tests, which may detect problems in liver function, as well as imaging tests such as ultrasound, computerized tomography, and magnetic resonance imaging, are used to diagnose liver cells. To make a certain liver cancer diagnosis, a sample of liver tissue may occasionally need to be removed for laboratory analysis. A tiny needle is inserted into your liver during a liver biopsy in order to collect a tissue sample. To check for cancer cells, doctors analyze the tissue under a microscope in the lab. The danger of bleeding, bruising, and infection during a liver biopsy is present. Your doctor will try to ascertain the extent or stage of the malignancy once liver cancer has been detected. The results of staging tests are used to assess the extent of the cancer spread and its size and location. CT scan, MRI, and bone scans are imaging procedures used to stage liver cancer. How is liver cancer treated? The course of treatment for primary liver cancer depends on the disease's severity or stage, your age, general health, and personal preferences. Surgery to remove the tumor or a liver transplant are two procedures used to treat liver cancer. Heating, freezing, injecting alcohol into the tumor, and injecting chemotherapy medications into the liver are some localized therapeutic options for liver cancer. If alternative therapies are ineffective or cannot be used, radiation therapy may be a possibility. In the end, if you liked this video, do not forget to subscribe to the channel and activate the bell button to receive all new updates. Goodbye.